Hello everyone, my name is Dr. Nguyen Tran. I'm a chiropractor, acupuncturist, physical rehab specialist, and I'm here today to talk to you about the spine once again, like I usually do. However, the topic today is about prevention. You hear that term all the time, but how many of you actually ever thinking about preventing? Talk about preventing, let's make a quick example. One of the major things of prevention is lifestyle changing. For example, if someone was diagnosed with diabetes, or you have a blood test and you go to the doctor tells you that you are pre-diabetic, you need to change something around, or you have to start taking insulins. What do you think? Well, the first thing in your mind is, oh my God, I have to be healthier, I have to eat better, I have to exercise thing. Well, how about your spine? You know, when you have a spinal disease, degenerative spinal disease is a chronic, but that will never change. But most people never get scared or change their lifestyle when they heard of back pain. Let me ask you this. Which part, your body part, do you use the most every day? And I bet you never think of it, is the spine. I talked to a bunch of kids who play volleyball and I asked them what part of the body they use the most. I think maybe their feet, their hand. But hey, I'm sitting right here. I'm not using my hand. My hand's on my shoulder's on my spine. When I'm sitting, my spine is working. When I'm standing, my spine is working. When I'm walking, my spine is working. When I'm cooking, my spine is working. When I'm sleeping with poor mattresses, my spine is working. Your spine working 24/7. If you don't have proper mattress, you don't rest them right. Imagine it, if something works, let's say 16-hour day, 7 days a week, 365 days a year, do they need maintenance care? Do they need care? And do you ever care for it? And you know what the scary thing is? Your spine is your central nervous system, it's part of it. This guy, the brain, talks to your entire body, to your spinal cord. Where's your spinal cord located? In your back. I've been doing this for 20 years, but it never seemed to amaze me that how many of us are not care for our spine. Because why? So many of us have back pain. Common doesn't make it normal. So this video today, I want you to be aware that back pain is a huge problem. It's the #1 problem in the US right now for disability. But going to a chiropractor, going to a doctor, that's not enough. That's treating the problem. How do you prevent low back pain? How do you prevent your spine from deteriorating quicker? The most difficult part that we chiropractors are facing with is to get patients to understand and get treatment early on. Because why? It doesn't hurt. But you know what? When you have poor posture, when you overuse your spine, just like you drive so much, if you put 20,000 miles on your car per year, that car probably lasts, 5 years, right? If you put 100,000 miles per year on your car, how many years that car lasts? So if you're sitting like this and you're using your spine, try 3 times more than the average uses. They don't break down right away, but instead of lasting your lifetime, they might break down in 30 years. But until then, you don't actually have any pain. But when your disc is herniated, your disc is broken, there's no new disc. There are no replacements. Surgery doesn't give you new disc. Surgery doesn't give you new spine. They just cut you open, patch it up, and some screws and metal in you. So the key here is figure out what caused your spine to work too much every day and how to change it. And I'm not talking about every now and then go to the gym, lift heavy stuff. When you lift something abnormal and you hurt your back, it's not the lifting that hurts your back. If your back was strong and healthy, that lifting shouldn't cause any problem. And that's why you lift it in the first place, because you think that you're capable of. We always overestimate ourselves. Why? Because we use our body and we're not thinking you use it. I heard this over and over all the time. Dr. Tran, I didn't do anything. Well, who uses your spine every single day? And I don't want this to be dramatic, but yes, we use our spine every day, but we never take responsibility for, I am using it. So when it's broken down, when it's weakened, I did it. Doesn't matter how strong something is, right? If you don't take care of it, you overuse it, it's gonna bust, it's gonna break. But your spine, when it's broken, there's no reverse, there's no going back. So thinking about what do you do every day. All right, so here, enough talking, okay? I talk about this all the time, but it's getting boring. So let me show you and do some demonstration, all right? So let's see, if me, Dr. Tran, get in the office, sit down like this, you know, perfect chair, perfect posture, everything. Put this in my back, sit on my back here, and adjust my table, my desk and my computer perfectly, right? And then I sit here for 3 hours. Well, you know, I start out here, perfectly, nice, everything. And then after about 20 minutes, what happened? My eye get tired, and that's why I'm gonna be like this right here, and like that. Now, I don't want that, right? But it's really hard to think about my posture when I'm working, on my head concentrating on something. So what you should do, well, you sit here, set a timer. Okay, let's say, all right, let me do a timer right here. I actually do have a timer on my watch. There you go. And then let's set 20 minutes, okay, or 30 minutes. All right, so now I'm ready to work because I have to worry about when I have to take a break because my watch will tell me so, okay? So if you're working here and I gradually go like this, and I'm working, and you see, seriously, just testing, but my neck kind of feels stiffness already. But we have almost there, 12, 9, 8, 7, 6, 5, 4, 3, 2, 1. Boom, there, my timer kick up. What I do? Get up, push the chair out of the way, hit a button, my table desk elevated. All right, then let me move around, move my back, stretch my neck, like that, drink a cup of water, and then go back onto the desk. Now I'm standing. Same thing, but I have to remember to set my timer so that I'm working on here. Same thing, start here really good, and then slowly, and I getting more into my work, I'll end up like that, and next thing you know, I'll be like that. Okay, so if my timer ring again one more time, then same, I take a break, walk around, and switch back and forth. And I know it's not easy to do. Trust me, I know it's not easy. But nothing's easy in life, right? Especially break up a addiction to poor posture, a bad habit. That's why it's called habit. You repeat something long enough, it becomes a bad habit. We want to convert the bad habit to good habit. Because if it's easy, everybody can do it. Just think if you are diagnosed with diabetic and you have to change the way you eat, you're gonna do it? Yes, you will. Same thing with the back pain, neck pain, posture problem. Remember, you don't want to be, you know, in your 50 and then, you know, like walk like that, can enjoy your life, can play with your kid, can throw a ball, can run around, and then you blame everything on aging. So start now. Take small break and think about what kind of work do you do every day, what affect your spine, what affect your posture. Let's say that was just example of me using a computer, but let's say if someone else who are doing mechanic, then you know you like this all day long, but you know, make sure strengthen your leg, work on your leg more, so that instead of like this, you actually get to the floor and go the way, work your leg so that your back can take a break. Remember, if your back is overworked because you work them too much, how else can you stop them from working hard? Strengthen the leg. If I squat down with my leg, my back doesn't have to do too much work. But it's hard to work with your leg when your leg have no strength, and also it's bigger, it's have more muscle. So in terms of, you know, saving on your mind, let's not use the leg because it costs a lot of energy. But what everybody's trying to do nowadays, we try to burn more calorie, don't we? What's the better way to burn more calorie than using the big gun, the big leg? You know, work on your leg. It's not easy, but start out, get down to the floor. Get up, do it often as you can, practices, right? What do we say? Perfect practice make perfect, right? You know, we have the leg, we have two legs, very strong. Work on them. Make them work for you so that the back can take a break. It doesn't matter how many times you come to see a chiropractor, physical therapist, get a massage. This guy is work too much, he's burnt out. Because you can come and see, it's like me, for example, for 1 hour, you know, 2 or 3 times a week, but you go back and, you know, sit like that or do that, not just at work. When you get so used to bend over, you do it for everything. Reaching, you know, for a car, grocery. So practice to work on your leg, get them to work for you more often, and then when you treat the back have a chance to revive. Because it doesn't matter how many times, you know, you treat your back, but as soon as they get back on the feet, you work them again. Just imagine you have a car and they're broken down, you need to take the car to the shop, right? Why the car's at the shop? Can you drive it? Obviously not. But when you take your body to the shop for chiropractic work, treat as soon as we're done, you go right back and use it again. That's why it's so hard for us to get rid of the back pain. Because we use them for all the time and we never realize how much we use them. So hopefully this video will make some self-awareness, because I want you guys to make sure the spine is so important, your back is so important. Your brain controls everything to the spinal cord here. It's a lot more important than just muscular pain, muscle pain, back pain. Because by the time you have pain, you lose 60% or more of your function. Doesn't matter if you're 40, 50, 60, you should be able to do what you used to do when you're in your 20s. Let's say play basketball, play volleyball, tennis, sport. Don't blame old age because you can't do something. Think about it, like if your car broke down today, you don't say, oh, I'll walk to work, I just leave the car there, right? You take it to the shop and then see whatever's wrong with it, you fix it and go back and use it. Same thing with your body. Don't deteriorate from sudden activity because you cannot do it because your body hurt or something's not working right. Get them fixed and then get back to it and use it. Because your body's all about you don't use it, you lose it. And if you lose it now, you never gain it back later. And it's a lot harder to gain the muscle you lost than maintain it and keep it up. This is 50 pounds, okay? That's 25 kilograms. At least 25 kilograms, a little more than this. But imagine this. When you lay down flat on your back, your spine only carries 25 kilograms. But when you're sitting like this, the pressure on your spine, take this, multiply by 11 times. That is what you pressure on your spine. Imagine that. Do you know that? I wouldn't want to be that on my spine, because that definitely do a lot of damages. All right, so after all this talking, can you guys give me some feedback here? Think about what you do every day in your activity, your daily activity, and let me know which activity you do the most that affect your spine the most and how you plan to change it. And if you need help, leave us a comment below and I'm more than happy to give you some tip on it. Until next time.